key point number 4 is regarding eating disorders. We talk about weight management, and we haven't really addressed quite being too thin. But being underweight or too thin can be just as much of a difficulty for certain individuals. You'll notice the top of the slide reads ordered with an arrow showing that it's a movement toward disordered eating patterns. Because really that's the way that it happens. It's not as true of a black and white as some of us might like to think of it. That some of us might have some in-between, components of disordered eating, but we don't have a full-blown eating disorder diagnosis. I start off with talking about images of ideal body weight because this is where they see maybe some of these disordered eating patterns begin. Is that, as we're little and we look at our Barbie dolls and our Ken dolls, we see this unrealistic image of how we feel an ideal body should look. Our media in this day and age is so prevalent. We have media images flashing in front of us, whether we're at home in front of the TV or we're driving down the freeway and seeing the billboards. We hear it on the radio. We hear it through our cell phones. There's even advertising coming through cell phones, our email. We're bombarded by images that are developed by the media to tell us that, gee, this certain type of a body is sexier or prettier or is our definition of success. And it's important for us as consumers to have an outside or real conscious awareness that this is going on. They're doing that to sell a product of some kind. But we also have to come into reality and realize that these are unrealistic bodies that they are showing us. If you took the Barbie model and you extrapolated that into a real person, there's no possible way that there's a female that could have the body that Barbie does. Her waist size would be some ridiculous amount like 12 to 13 inches, and some of the other measurements as well are completely impossible. As well, when we look at models in magazines, we need to remember that those are modified images by computer graphics, and they can do so much with stretching the legs and changing their skin tones, etc. That these are not realistic images. And it's a problem because then people go into this fantasy idea in their mind that their body should be that, when it's an almost unobtainable possibility. Advertising in fashion magazines, typically they go with the very uncommon size model. The average size woman is size 12. So most models are wearing somewhere around a 1, a 2, or a 0. Food is also linked many times to personal emotional experiences. And when we have a lot of that happening for any one individual, it many times can lead to disordered eating patterns. Greater than 12 million people in the United States suffer from eating disorders. First off, we'll talk about anorexia nervosa. The U.S. culture favors the development of this particular eating disorder. We are a very wealthy nation. Food is very prevalent in our nation. And those are the paramount components of any culture that promotes or seems to propagate eating disorders in some fashion. It typically affects women, although I need to make note that there is a trend in the United States that more and more men are suffering from eating disorders of one kind or another. And again, this relates to how our media is perceiving that, and how the promotion of plastic surgery is also affecting men. Anorexia nervosa, the diagnosis has specific components that need to be present before it would be diagnosed by a physician. It includes refusing to maintain a normal body weight for their age, having an intense fear of weight gain even though they're already underweight, having distorted body images, so they themselves see a body that may be overweight or unideal, whereas everyone else around them sees a very thin, gaunt-looking person. Also amenorrhea, which is having their menstrual cycle stop, having that have been stopped for more than 3 months. having all those components allows the physician to diagnose the disorder. Typical family characteristics of someone who might have eating anorexia nervosa is that there's often rigid and overprotective parental control. Parents might have really high expectations and be from an upper middle class family that's very educated. Some of the personal characteristics that someone might have that has this eating disorder is a strong desire for control. They might feel controlled by others, whether it's the dominating parents or siblings, and feel the need to exert a certain amount of control on their own life, and they express that through the way that they eat and control their food intake. They might have an addictive personality, obsessive or compulsive, specifically related to a fear of fat, and have perfectionist tendencies. This person also usually has tremendous discipline. They have extraordinary lifestyle habits where they exercise to extreme levels and they follow a very low-calorie diet. In addition, they might have distorted body images, and many times they would panic with just a small amount of weight gain. There's certain types of athletes that have a tendency to struggle with this, and those are the types of athletic competition that require someone to make a certain weight or be a certain weight to move forward and be seen as a elite competitor in that field. Ballet is like this, gymnastics and wrestling are some of the key areas. Sometimes it crosses over though into long distance running and some other athletic types of events. It's important for coaches in these areas to be aware of how they might impact children or young adolescents who are trying to be their best in these athletic areas, because it can make a big difference in how they might either perceive their body or perceive the way they should eat to be the best. What are some physical characteristics that come along with the diagnosis of anorexia nervosa? Well, some of this depends on severity and how far along someone is with the eating disorder. But typically it has the same effects as protein-calorie malnutrition, which we talked about when we talked about protein. We're basically starving the body. So in the same way that in protein-calorie malnutrition, the body starts to use up some of those peripheral proteins for energy. It's not getting calories in to serve its basic daily needs, so it needs to get calories from somewhere. How does it do that? Well, it catabolizes or breaks down parts of the body, some of the muscle and proteins that are available, as well as fat tissue if there is any left. So you might see hormonal changes because hormones are proteins. So the body's breaking those hormones down to get energy from them, and instead of those hormones being able to work in the body to continue the menstrual cycle or continue their sex drive. Heart function decreases. Again, it's because the heart is a muscle, and that muscle is becoming weak and thin because it doesn't have the substrates to be able to rebuild its own tissue, and the tissue actually might be being broken down to provide energy for that particular person. As it gets weaker, it's less able to pump blood efficiently throughout the body. GI tract, you see decreased peristalsis, which is the movement of the GI tract. You might see diarrhea and atrophy. Impaired immune response. Again, we go back to the fact that the antibodies are proteins, so the body is breaking those down just merely to provide daily energy. How do we treat anorexia nervosa? Well, first let me go back and say that from a medical standpoint, anorexia nervosa is considered the most dangerous for an individual to be suffering from of all of the eating disorders. So it's important that we put together a good multidisciplinary team approach to help this person recover before their medical situation gets too severe. A physician, a psychologist, a dietitian, nurse, and family and friends are all components of this person getting better. What might be the most effective for many people who suffer with anorexia nervosa is an inpatient type facility. And what this is a center where they would go live for a while. Their food is controlled, and their environment is more controlled. What's good about this is it removes them from, hopefully, many of the factors that were exerting some sort of pressure or control over them that might free them up and allow them to concentrate on themselves and getting better. Bulimia nervosa is the second type of eating disorder we'll discuss. It's more common than anorexia nervosa and is often associated with depression. We see a higher incidence of bulimia nervosa in college women, and typically it comes with someone starting with severe dieting. So they go through this deprivation phase, and it's kind of this cyclical problem where they get so starving, which might be a very realistic response if they are not eating, or let's say they're living on cabbage soup as their special diet plan. So they get super hungry, a normal response, and then they binge eat. So they eat large amounts of food to try to compensate for all that deep hunger. And then after that binging, they feel very guilty. So then they purge, which is they get rid of it in some fashion. For some, it's through vomiting. Some, they take medications or laxatives to try to clear it. And some do it through what we call hypergymnasia, or excessive working out, to try to compensate for all that they ate. Diuretics is another way that someone might try to compensate for the binge that they just had to prevent weight gain. What are some personal characteristics of someone that might suffer from this? Being single, being female, Caucasian, well-educated, and many times they're very close to their ideal body weight. That's what IBW stands for. These people aren't extremely thin or extremely heavy, typically. This is just your general profile. Doesn't mean someone can't be outside of that profile, but that's the general profile. When we talk about the binging, it's this compulsion to eat for comfort. Often they do it in secret, and it can include thousands of calories in one sitting. And folks that suffer from this many times report that they learn, or they start to realize which foods are the easiest for them to purge. Things that are soft foods like ice creams or cheesecakes are a little easier for them to clear. So they might go to those types of foods for their binge. After the purging, there's usually some sort of guilt and shame that continues with it, even though they've already made themselves vomit, or they've taken the laxatives, etc. So some of the dangers with the self-induced emesis that goes with bulimia is fluid and electrolyte imbalances. When it happens excessively, abnormal heart rhythms because of that electrolyte imbalance. The electrolytes do affect how we maintain a regular rhythm of our heart. Kidney or injury failure might take place. Teeth erosion. Many times dentists are the first to notice that there's some problems going on with the teeth, the backs of the teeth, from all the acid that they have in their mouth after they induce vomiting. Esophageal ulcers are some of the more severe consequences that might take place, or rupturing or tearing the stomach or esophagus. How do we treat bulimia? First off, we would work to decrease the diet cycles. So we start with trying to take away that deprivation and that dieting, and implement some structured eating patterns, some schedule to eating. Even if it's small amounts of food, having scheduled times to eat throughout the day, with a goal of weight maintenance, not necessarily to gain weight. Also, if depression is a component, treating for that with antidepressants. Sometimes this is a difficult thing to do because somebody with an eating disorder is usually quite aware of things that might make them gain weight, and antidepressants are notorious for causing weight gain. Body image is another area that we would work on, not only with bulimia but also anorexia nervosa. It's a very key component, is to help them see their body as it really is versus the images that they've kept in their brain for so many years. This is just another graphic to show some of the cycles that go on with relationship to eating disorders. How do we prevent eating disorders? First of all, everybody realizing that some concern is normal. Everyone has that. Discouraging restrictive eating or dieting and fasting. If you're a parent, watching the way you talk about food in your body around your children, never really talking about, how you have to go on a diet, or you need to lose more weight. Talking about health is one way to talk about it, to keep it in the proper perspective for your children, because they will pick up on those perception and those ideas that you have if you're talking about it around them. Correcting misconceptions that you might have, or that the person might have about nutrition, safe weight loss, or normal body weight. Encouraging normal expression of disruptive emotions. So if you're raising, again, a young girl and she is heading into her teen years, helping her with expressing what her emotions are that might be disruptive in a positive way, in a forum that she will be heard without feeling like she has to express that control. She doesn't have to tuck those emotions in and then express control in another arena, such as with her eating. Also encouraging coaches about weight sensitivity. This is still a great area where a lot of education needs to happen. So if you're in a particular educational setting, going into that school and making sure that you help those coaches understand the problem. Being careful about how you phrase weight-related comments, and encouraging children that when they eat only when they're hungry. So a guideline for when they get up from the table is your tummy full? If yes, then it's time to get up. If no, then you continue to eat. Not forcing them to finish their plate or any of those types of rules. How to help a friend. Looking for warning signs, listening sympathetically, being supportive, and looking for professional help. I'll post under the extras for week 5 some links to some great supportive resources for helping a friend that you think might be suffering from an eating disorder.